Thank you, Sahani sir. Good evening.
Dr. Dhanesh, you can take over the session now.
Yes, sir. Good evening.
You can.
Yes, sir. I can hear you, sir. Good evening, good afternoon, and good morning. This is the 1673rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Komal Patel. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who misses the session can watch it again. And you can share it with your friends. And the purpose of the forum is to take homeopathy to every household around the world. Sorry to say that for the last 5 days, we are unable to upload the videos since there was a technical problem. Everything was rectified today. So tomorrow onwards, we will be uploading the previous videos. So with the regret, I'm saying that. And now let me come to today's guest. As you all know, Dr. Komal Patel has completed MD in homeopathy, and she is pursuing her PhD in organon of medicine and is working as the assistant professor in Homeopathic Medical Ahmedabad Homeopathic Medical College. Ahmedabad Homeopathic Medical College. So, and today, doctor is presenting an important subject, and let us proudly welcome the guest of the day, Komal Patel, to that. Sahani sir, you can introduce something more on that.
Sir,
Yes.
can you make the
Yes,
Dr.
yes, sir.
Komal
I shall make it, sir. You can say something about Dr. Komal Patel, sir.
Dr. Komal Patel has already presented her lecture in Hindi session. It was marvelous, and she said she was unable to speak properly in Hindi. I said, no, you spoke very well in Hindi, but you have to speak in English also. So I understand Dr. Komal Patel.
Yes, sir. Yes, sir. That'd be difficult for us to speak in everything in a Hindi, sir. So that's why. But we try for that,
Yes,
sir.
Yes,
Dr. Komal, don't worry. I know
Yes.
that Ahmedabad Homeopathic, I had visited Ahmedabad Homeopathic Medical College.
Yes, sir. Yes, sir.
And
Yes, sir.
I know that this college is doing wonderful job, and all the faculties there among with you are doing their best, and I feel that this institution, Ahmedabad Homeopathic Medical College, Ina Rawal is there, and
Yes. She's my mentor.
job.
Okay, sir. Okay, sir. Once again, once again.
Thank you very much, sir. We appreciate us and with our college.
Yes,
Thank you.
Let me say something more on that. Dr. Komal Patel has completed MD in homeopathy, then PhD. She is pursuing PhD, and she has completed CFG also. Is the professor, not the assistant professor. She is the professor, department of working in the at Ahmedabad Homeopathic Medical College, Goa, Gujarat. And the subject of discussion today is key of prescription symptomatology.
Yes.
Yes, we proudly welcome you to the session.
Thank you, sir. Thank you, sir. Let start with I'm sharing my PPTs, sir. Now, sir, my PPT is visible to all of you.
Yes, it's visible.
Okay. So we all know about the most important thing in a homeopathy, that is a prescription. And we know the Dr. Honeyman says that the prescription is always based on the similarity of the symptoms. So without symptomatology, without learn the symptomatology, we never read or we not never prescribe the medicine to any person or any patient. So for that prescription, to understand what is the symptoms and what is the importance of the symptoms and how we gather the symptoms from the patient, that is most important thing for homeopath. So that's why I am choosing this topic, and this is what we are say the heart of organon. And because of everything, our prescription totally and our second prescription, everything is based on the appearance of the symptoms. So that's why this is the most important topic to learn by everyone, even a practitioner, student, and everyone. Because of on that base, we has to do the prescription. So we start with that. This is my objective for that session. The main important things to know the symptomology, that is the selection of the similimum medicine, and that is totally based on a characteristic symptoms. Dr. Honeyman said it is a PQRS symptoms, are on that we has to do the prescription. Understanding the patient state. So from the symptoms or sign, we identify the what the patient is suffering. Patient is curable, patient incurable. This everything we get from the symptoms. So Dr. Hahnemann mentioned in third aphorism that what we perceive in the disease. The perceive in the disease is a form of symptoms. From the symptoms we know the disease. Differentiate the different remedy. So differentiation of the remedy, because of our materia medica, there's a further, our old materia medica is a pure, the name is materia medica pura. The pura, that means pure experiment done on the healthy human being, and they are mentioned in a materia medica. And this materia medica also contain the symptoms. It is we say the C of the symptoms. So for the differentiation of the remedy, we also identify the different symptoms. To monitoring the progress, because of if the patient is progress good or bad, everything is also based on the general condition of the patient, and they are also identified from the symptoms of the patient. And then last but not least, there is a diagnosis of the disease. A diagnosis of the disease also based on the symptoms. So by the end of this session, we learn about the how this is a main aim to know about the why we are knowing the symptomatology better. So now we go through the very basic introduction, that is a meaning of the definition of the symptoms. Any perceptible change in the body and in its function, either subjective or objective, which indicate the disease of the kind of the phase of the disease. This is the meaning of the symptom according to Webster's dictionary. Now, what is the sign? In homeopathy, that is a sign is known as objective symptoms, but it is a part of symptoms. We are in homeopathy, we are not say the sign in a further way. We are include the sign in a symptoms. So these are the alteration of the state of health which is observed or detected by the physician or attendant or the patient himself. So this is a visible with our naked eyes, that we are say the sign or objective symptoms. Now, according to homeopathy, what do you mean by the symptoms? Dr. Honeyman mentioned in aphorism number 6, the change in the health of the individual are represented by the symptoms. So here the change in the health of the body, of the mind, which can be perceived externally by the mean of the sense, that is to say, any notice on the deviation from the formal healthy state. So according to Honeyman, according to homeopathy, Dr. Honeyman says that the change in a state of health, they are symptoms. So we think about the word symptoms. Symptoms, what is come from the symptoma. That means anything that happen, a change in state of health. So that's why the symptoms which we are symptoms which are produced by the change in state of health, and they are felt by patient himself, remarked by those as the attendant, and observed by the patient, observed by the physician. So according to aphorism number 7, Dr. Honeyman mentioned about the totality of the symptoms, and he says the symptoms can be defined as an external expression of the internal deranged vital force. And for that, making the totality of the symptoms, we having a thorough knowledge of the symptomatology. So this is a basic classification of the symptoms according to different stalwart of the homeopathy. So we first go to the Dr. Honeymanian classification of the symptoms. Dr. Honeyman mentioned about the symptoms in the aphorism number 153. Here Dr. Honeyman says that those symptoms which are peculiar, rare, uncommon, characteristic symptoms, they always help for select the homeopathic specific remedy. That means they help to make the totality of the symptoms. When the symptoms which are, we are say weakness, headache, fatigue, which are common, loss of appetite, loss of sleep, these are the commonly present in a different disease condition, and they are commonly seen in each and every medicine in a materia medica. So they are the not, they are the weak symptoms, or Dr. Honeyman said they having a lesser important in a selection of the similima. So this is according to Dr. Honeyman, the symptoms which are uncommon, they are helped to select the homeopathic specific remedy, and the general symptom, they are, Dr. Honeyman assume that is a common symptoms, they are have no importance in selection of the similima. Now there are the Dr. Kent. Now Dr. Kent, he classify the symptoms and he give a value to the symptoms also. So he classify the symptoms general, particular and common. General symptoms. According to Kent, general symptoms are those symptoms which are perceive a patient as a whole, which are narrated by I and my by the patient. So I am a thirsty, I am a hungry, I have a craving for ice, I have a craving for hot milk. So these are the symptoms. I am happy, I am sad, I am nervous. So these symptoms which are belongs to a general state. Now the particular symptoms. Particular symptoms are those which are present in a particular part of the body, which are present in a particular organ, or they represent a particular system. For example, a burning on epigastric region, a burning in the eyes. So these are the symptoms are known as a particular symptoms. Common symptom, they are those symptoms which are commonly seen in each and every diseases. Now Stuart Little classified the symptoms in a two part, a subjective symptoms and objective symptoms. H.A. Robert also classified the symptoms in a two parts, subjective symptoms and objective symptoms. Now, according to Garth Borick, the Garth Borick is also classified the symptoms in two parts, basic and determinative. A basic, that means common symptoms, and intermediate symptoms, that means uncommon symptoms. So this is introductory things about the how the symptoms are interpreted by different stalwart in homeopathy. Now we go through the Boni-Gusain classification. So Boni-Gusain classify 7.2 segregate the symptom for practical assessment. He classify in a 7 part. He first give importance to cues, that means personality or individuality of the person, that we are say the mental makeup of the person, that is a mental state of the person, or the symptoms related to a mind. The quid, that is a disease's nature and peculiarity. What the disease the patient have? What is the nature of the disease? It is a acute or chronic? It is a curable or incurable? If there is a curable, how much the curable? It is incurable. What are the pathology developed to a person? So this is also important for this. From that we has to select the simillimum. Now UB seat of the disease, where the disease is situated. Now the cumulus exilis, that means the concomitant symptoms, or it is also known as associated symptoms. That means they are symptoms along with the chief complaint, but they having no pathological or physiological relation. So these type of the symptoms become more characteristic symptoms for the selection of the simillimum. Now that means cause of the disease. What is the element from, or that is a causative factor that leads to the disease. Here the cause of the disease, we has to know about the, according to homeopathy, there is a 3 type of the cause of the disease: exciting, maintaining and fundamental. But Dr. Honeyman says that the fundamental cause is a prima causa morbi, and from that the causa occasionalis, that means exciting and maintaining cause are affect the person. So without the prima causa morbi, no one is susceptible to an environmental factor, not one susceptible to exciting or maintaining cause. So now the comedo, that means the modality according to circumstances or the position, and the condo, that means time factor. So Boni-Gusain classify the symptoms in a 7 part, and from that if we proceed, so it is also known as the totality of the symptoms according to Boni-Gusain. So from that, if we put all our patient symptoms after the case taking in this part, we able to select the simillimum medicine. Now Boger says that the art of carefully fitting the pathogenic to clinical symptom. This clinical symptom picture based obtained by asking the patient is telling his own story, like a modality. a nature modification of the sickness are most important according to Bogarin. Their mental state come to next order to importance. The sensation pain patient have, the entire objective aspect expressed by the sickness of the patient, a part affected. Along with that, the what are the tissue changes, which are the diagnosis or investigation we have to apply, and from that we anything we find uncommon, there is also help for selection of the minimum. Now we go through the one by one the symptom. There is a subjective symptoms. So those type of symptom which can be experienced by the patient under emotional, intellectual and sensual aspect of the patient. So these are the symptoms are inner of individual, is the inner core of the individual. They include the mental state, his personality, its attitude, its reaction to the environment, his desire, aversion, his like, dislike. These are the symptoms are most important symptoms, and these are the symptoms which we are become a key for the prescription. Now the objective symptoms. We know about the subjective symptom, but it may be a right or wrong, but the objective symptoms always right, because of it is evidence of the subjective symptoms. So according to Honeyman, the expression of the disease in a sensation and function of the side of the organism exposed to sense of the physician and beholder. So these are the visible sign. If the patient is say having a knee pain, if we examine the patient and we see the swelling of the on the area of the knee, that indicate the yes person having a knee pain. So these are the evidence of that disease, or they are help for the, or which we are saying they are help for the diagnosis of disease also. So now we go to the examples of the subjective and objective symptoms. For example, example of subjective symptoms, all the characters of the pain, sensation, feeling hot, cold, tingling, numbness, crawling, sensation of weakness, heaviness, emotional mental symptoms, feeling of anxiety, fear, sadness, irritability, desire, aversion, food craving, dislike, feeling fatigue, feeling weakness, loss of appetite. So these are the symptoms come under subjective symptoms. Now these subjective symptoms are mentioned in our medical like that way. The example like arsenic are, when think about the arsenic, so the intense anxiety, especially about the health, they predict the time of the day, restlessness, feeling cold, burning pains. So these are the subjective symptoms of arsenic. Like a pulsatile, like we take the emotional sensitivity, tearfulness, desire for sympathy, consolation, changeable mood, feeling better in open air. These are the subjective symptoms of pulsatile. Now we think about ignitia, the disappointment, grief, signing, deep signing, feeling of lump in the throat. These are the symptoms of ignitia. Now the nux vomica, irritability, anger. For example, they're having a craving for a spicy food, noise sensitivity, digestive upset from reach or stimulus. So these are the symptoms which are come under subjective symptoms of the patient. Now they go through the objective symptoms example. There is a skin eruptions. When they are visible in a skin, a change in body temperature, swelling of the gland and joints, tonsillitis even. If patient say the pain in the throat, we examine the throat, we see the inflamed tonsil. Quinsy development, change in the color and consistency of bodily discharge, observation of the behavior, tantrum, takes posture, redness of the eye, blood pressure. Even we are so by knowing this example, we know that a physical examination, that is a general and systemic, they are reveal the objective symptoms in short. Now, in certain medicine, we see the twitching and convulsion during teething in infant, bluish and visible trauma in the arnica, visible leg cramp in a croup-met. So these red inflamed tonsil in case of belladonna, the development of the quinsy in case of silicia. So these are the symptoms which are objective symptoms, and they are help for the identify the disease. And sometimes when they are casuistic, they help for the selection of the simile. But the most important thing for the objective symptoms in certain patient, when there is a language is a barrier, a patient is not able to, or they are not know the local language, and this is also very difficult to take the subjective symptoms. At the time, objective symptom help us. The second point, the patient is deaf and dumb, not able to speak. At the time, or this we are saying pediatric case taking, the objective symptoms are only and only help to prescription. Now, the in cases of what we are saying, the cases where the patient is unconscious, At the time, we are from his objective sign, we able to diagnose the disease and we has to manage the case. So in this certain condition, we only rely on a objective symptoms. And so in this type of the cases, objective symptoms, especially in infant in pediatric case taking, this is the most important symptom for the selection of the simillimum. So now the next, that is a general symptoms. So general symptoms, these are those symptoms, they refer the individual as a whole. So they are its inner symptoms. What we are said, they are the constitutional symptoms. So Dr. Kent is classify the general symptoms in a two part, mental symptoms and physical general symptoms. Now the mental symptoms, why they are general? Because of if we are said our whole body is suffer. So here that the symptom reflect the inner self, innermost part of the ego of the individual. So he further classify we are the mental symptoms in three parts: will and emotion are most important. They are first grade symptoms. The symptoms related to intellect and understanding, they are second grade, and the memory they come to third grade. But always we say the mental symptoms are most important symptoms for the prescription. Now the certain example of the mental symptom which we see in a different medicine. For example, emotional sensitivity of the pulsatilla, nervousness, hysterical appearance, state of whipping tendency, desire for sympathy, consolation, changeable mood, insecurity, gentle disposition. So these are the related to a pulsatilla. Now these symptoms mostly are related to what? Will and emotion. Now we having a pulsatile symptom, that's a forgetfulness. They are come under memory. Now the ignition, emotional upset, grief, disappointment, hysterical, contradiction, mental state, signing, mood swing, sensitivity to emotional stress. So these are the symptoms of ignition. So aurum met having a deep depression, fatigue of worthlessness, thought of suicide, strong sense of the duty. In California, the mental exhaustion, nervousness, irritability, difficulty, concentration, often due to overwork or stress. So these mental symptoms are help for selection of the symptom, but it is a difficult to take it. Second thing, why if it is not difficult, then what is the reality of that symptom? It's true or false. This is also we has to know from his cross questioning, and so that's why Dr. Honeyman mentioned in aphorism number 98. After complete the case, we has to use our tact. We circumspect our patients. We having a knowledge of human psychology. So from that we decide which are the symptoms are real symptoms of the patient or that is a vague symptoms of the patient. And from that we able to select or we make the totality of symptoms and select the minimum medicine. Now the physical general symptoms. So those general symptoms are felt by patient as a physically part. They are known as a physical general symptom. For example, general reaction, a feeling of cold, feeling of heat. So with the atmosphere, there is a changes or the in the body. Element from circumstantial, dietary or physicals. Like literally literally affection, sleep and its disturbance, appetite, thirst, desire, aversion, a sexual complaints. So these are the symptoms are come under the physical general symptoms. So now there are certain examples of that. So chilliness, sensitivity to draft, aggravation for the stimulant, general feeling of being out of shot. In a sulfur, that is a warm burning sensation, itching, aggravated from heat, tendency towards the skin problem. In gelsemium, feeling of weakness, trembling, heaviness. In a phosphoric acid, general weakness, fatigue, feeling of debility. So these are the symptoms are come under physical general symptoms. Now, where the physical general symptoms are most important? Because why they are most important? Because of the mental symptoms, they are general, they are most important, they are striking, but it is difficult to take in the case. If we take it, it is a right or wrong that we have so decided. But the physical general symptoms are easily get from the patient, and they are always mostly they having a for example reality, or they are not a false one telling by the patient. So if we make our prescription on physical general, we are able to select the simillimum. Now for that, Dr. Kent is explained one example in his chapter of value of the symptoms. He give an example of the prolapse of the uterus and the dragging feeling a patient have. Now, in the case of prolapse of the uterus, there is a uterus is coming out from the womb. At the time, there is a hang and the sensation of dragging. It is a common symptoms.
So from these common symptoms, how we prescribe the medicine? Because of if we see the rubric of the dragging sensation in the worm, we having a multiple medicine like a lilium ting, there is a murex, there is a what we have said sepsipia, nux vomica. These are the medicine which are wrought under the prolapse of the uterus. But how we select the simillimum? So for that, the journal will help us. Like a patient is irritable, angry, desire for the spicy or stimulant. The chilly patient, they having a constipation and he has to pass through more than one time and there is no satisfaction. So now from that we are say this is the patient is nux vomica. So general symptoms rule out the particular. That means they are help for select the simillimum. They are important in acute as well as chronic disease also. In acute disease, a general and differential. Because of in acute disease, what happened? All the complaint are related to the disease that we are observing more. If the patient having a viral fever, so we are see this common symptoms of the viral fever. But the patient with the like, for example, we take it a patient having a fever with the there is a high graded fever. Patient having a redness on the face. The redness of the whole body or redness of the face or the false breath or that is the symptoms of belladonna. Are you getting my point? So fever with the redness of the whole body, this is the symptoms which are we are say physical general symptoms. And from that we prescribe the simillimum medicine. So physical general symptoms are most important for the selection of the simillimum, especially those are the beginner. They are not able to or they are not that much used to or acquainted to take the mental state of the patient at the time. These symptoms are helped for the selection of the simillimum. Now they are the other two types of the general symptoms. That is a negative general symptoms and pathological general symptoms. Now, what do you mean by negative general symptoms? So those symptoms which are expected to be in a case but remain absent. That means we are expecting something. For example, in case of causticum or in case of rheumatism, we are expecting that the rheumatic pain is aggravated in the damp weather. Commonly, we see all the rheumatic pain is aggravated in cold and damp weather. But in causticum, the opposite we see. The rheumatic pain is relieved by damp and cold application. So these are type of the symptoms are become a negative general symptoms. So they are become valuable when they are absent. So these symptoms are present in the patient. These are the peculiar symptoms of that case. So absence of pain in inflammation, absence of thirst in a fever like a pulsatilla, rheumatic pain relief in the damp weather like a causticum. So these type of the symptoms are negative general symptoms. And they are help for the selection of the simillimum. Now the pathological general symptoms. The expression of the person which are known by study of change at the tissue level. So we see the patients having a warts. A warts is all over body, or we see the tumor, a tendency of development of the tumor, a tendency of anasarca, tendency of the edema. So certain pathology we observe in a more than one part of the body in a single patient. Now they are become a pathological general symptoms, and Boger give a more importance to this pathological general symptoms, and they are from that he select the simillimum medicine. So now what is the value of the general symptoms? It forming a totality of symptoms, it helping individualize the person, is helping selection of the simillimum. Now particular symptoms. There are those symptoms belong to particular part, organ and function of the body. These symptoms tend to disturb the patient most seek consultation from only. And this is a prescription accuracy based on these particulars. So I earlier say that like that way, the particular symptoms are more marked in acute disease as compared to a chronic disease. So they are help us for the uncommon particular symptoms help for the selection of the simillimum. So now certain examples of that like Allium cepa, runny nose with a clear water discharge, burning watery eyes with bland nasal discharge, often used for eye irritation, allergies, and IFPH as a medicine. In the canthar is severe burning pain in UTI, intense urge for urination, often used for cystitis, cuprum muscles cramp and spasm. So for example, soreness on the throat in case of belladonna. There is a stitching type of pain in a parcel. So this is a particular symptoms of the patient. And if these particular symptoms are casuistic, they are help for the selection of the simillimum. So what is the importance of particular symptoms? At the time, strong particular may point out small group of remedy help to quick prescription in acute disease. According to Bonning-Hussain, they provide the base for evaluation of the journal, because of Bonning-Hussain give a idea of the grand generalization. So Bonning-Hussain says that this is true for one part of the body of the patient, that is true for other part. So this is a grand generalization is also based on the particular symptoms. When according to Kent, when the more than two particular are same symptoms are present in a same person, they become a general symptoms. So the when particular symptom express more than two place, it behave the general and become a more important. So particular fund is a detail of differentiate the remedies also. So for therapeutic prescription is based on these particular symptoms. Now the uncommon symptoms. We know about the subjective, objective, general and particular. First, these all the symptoms, if they are common, they having a no role in a selection. But they are uncommon, they having a role. So now uncommon symptoms in a different place of the organ or philosophy is mentioned as a non-pathognomonic symptoms, a casuistic symptoms, a keynote symptoms, a determinative symptoms. So the different terminology used for the uncommon symptoms. So now who say the non-pathognomonic symptoms? So Stewart say that these are symptoms which are not common to the disease, they become a non-pathognomonic symptoms. The casuistic symptoms, Dr. Honeyman say for help for the selection, the keynote symptoms given by Gunsey, his prescription is based on a keynote symptoms of the patient and they match with the materia medica. Now, determining symptoms. This is according to Garth Bodick. Garth Bodick say the determining symptoms, they are the casuistic symptoms and they help for the selection of the similimum. So now uncommon symptoms. So they denote those symptoms which are peculiar in their nature and character. They are striking one. They make a attention to, they become a attention for everyone. So there is a no, and sometimes we are say that there is a no explanation is possible for their symptoms. Even we are not explain. For example, we take the symptoms of a sore throat. The patient is a sore throat is really by taking cold drink. Now we having a no explanation for that, which are peculiar to few patients suffering from similar disease. The basis cannot be explained on basis of pathology. Their basis is constitutional makeup of the determine the psychic of individual. They usually help in a management understanding of the case also. Now the certain example of casuistic symptoms, we know the arsenic alb, the burning pain relieved by heat, the headache is relieved by application of cold, a fear of death, fastidious nature in the pulsatility, the changeability symptoms, desire for a open air, aggravation in a warm room or a closed room, a thick blend yellowish greenish discharge, consolation relief is all complaint. So these are the symptoms of pulsatilla, nux vomica, irritability, anger, sensitivity to noise, odor, aggravation from stimulant, constant urge for stool but ineffectual staining. In a sulfur, burning sensation, rage, philosopher, itching aggravated by the warmth, aversion to bathing, feeling of internal heat, burning in the soul, in the sepia, indifference to a loved one, irritability, feeling of bearing down in the pelvis. So these are the uncommon symptoms, and for bearing down of the pelvis in the products of uterus is a common. But what sepia is doing? It crossed that leg. So that make the symptoms uncommon. Now, so what is important for individualize the case? We know everyone. These are the symptoms which our prescription has been. So everyone, we are as a practitioner, we always search for the casuistic symptoms. They help for the selection of the similimum to form a picture of the disease, to form a portrait of the disease. So these are the most important symptoms for selection of the similimum. And they are the real key of the keynote symptoms is for the description. And Dr. Gansey says the keynote symptoms or casuistic symptoms. At least we have a 3 casuistic symptoms. So Allen's 3-leg stool. 3 casuistic symptoms is required at least minimum to select the similimum. If we find one casuistic symptoms in a patient and then we select the medicine, it is not like that. We get the more casuistic symptoms, we get the more similimum medicine to that case or patient. Now the common symptoms. So we know about the common symptom. We are all not fond of the common symptoms, but these symptoms, when they are occur with the group or they associate with the one another. So 2 common symptoms or 3 or 4 common symptoms combined together, they form a cystic symptoms. So we'll take example of that. So now the pathological symptom, pathognomonic symptoms, diagnostic symptoms, or basic symptoms are the common symptoms which are different terminology used in organ or in philosophy. Now the common symptom, these are the symptoms which are linked to disease and express the large number of the patient. They are little value in selection of the remedy. They do not help prescribing for individualized. Now, like that is a common symptom. Example, we are taking the weakness, headache, fatigue, loss of appetite, sleeplessness. These are present in each and every medicine of Materia Medica. We see they are mostly seen in each and every type of the disease of the patient. This type of symptoms we are commonly observed in everyone. What is the importance of this? They are also importance in diagnosis of the disease. They are helping to decide the prognosis of the disease. From that, we know the complication of the disease. And if we know the diagnosis of the disease, they having a multiple factor. For example, we able to diagnose this. We give we are identify the disease, and we has to tell the patient that this disease you have to suffer. We not say that, like Dr. Candice give an example of nux vomica. We are not saying that we select the medicine, the nux vomica for that patient, and we are saying you are suffering from nux vomica. We are not likely to say like that. We have to diagnose the disease. We have to say you are suffering from a viral fever. You are suffering from a dengue fever. You are suffering from a chronic gastritis. So, for the given name to the disease, we also a requirement of common symptoms. If we give a name to the disease, is having a medical-legal importance also. For issue different certificate, for a fitness certificate, for sickness certificate, for death certificate. We have to know the name of the disease, and this is totally based on a common symptoms. So common symptoms also help us to decide the group of remedy, because we know the patient suffering from dengue fever, we having a certain remedy, they having a bone breaking pain. Combined is Epitorium, arnica. For example, these Rustox brand, this type of medicine come in mind because of they having this symptom. So common symptoms not guide us to a simillimum, but they are help to guide a group of remedy. For the therapeutic indication, the common symptoms are important, and I am saying that when the more than two common symptoms are combined together, they are become a casuistic symptoms. Are you getting? For example, pain in a headache. This is a common symptoms. But now the same patient having a headache and headache with having a diabetes and they're having a profuse urination. But now these two are come together. Headache is relieved by profuse urination, and this is the keynote symptoms of gelsemium. So that's way the common symptoms when combined together, they make the uncommon symptoms. Now, and how we make the common symptoms uncommon? So for that, what we do? We have to, if the patient having a burning pain in epigastric region, and this burning pain is relieved by taking cold, relieved by heat, warm food, or relieved by for example, open air, or by inhaling the cold air. So these are the symptoms who, if we add the modality or along with the common symptom, they become a casuistic symptoms. Now the concomitant symptoms. So the concomitant symptoms, or about the concomitant symptoms, explained by a Bodingusen. Bodingusen says that the associated symptoms of the chief complaint, they having no any relation with each other. They having no any pathological physiological relation, but they are occurrence at the same time. So they are become most important symptoms. For example, a mental state associated with the physical complaint, a physical complaint associated with the mental state. For example, in arsenic, a patient having a breathlessness, or they having asthma. Along asthma, when the asthmatic attack is running at the time, arsenic say, I have a tremendous anxiety of my health. He is predicting his time of death also. So now his physical complaint associated with the mental state, now it become a casuistic symptoms. So the concomitant symptoms, when they are present in the case, they are always casuistic symptoms, and they help for the selection. So the concomitant bear no relation with the chief complaint, the time association. When these are that cannot be explained by pathology, they become a casuistic symptoms. Concomitant arise from the inherent constitutional aspect and tend to remain constant with the patient irrespective of nature of disease. Rely found that combine the main affection here, they also infrequent under the same condition in the proving. But these type of the symptoms we are less find in a patient because of they are less seen in a proving also. So all this belong to another sphere of disease, and that is the main one. Now, according to Dr. Boning Hussain, the totality of the symptom not only a sum total of the symptoms, but it is a so here the concomitant symptoms, we give a certain example like a headache is relieved by profuse urination, breathlessness with the mental anxiety. So these are the concomitant symptoms. For example, in case of argentum nitricum, the patient having a stress or nervousness that leads to a diarrhea and diarrhea. They pass to stool repeatedly. So these are the concomitant symptoms. If they are present in the patient, they help for the selection of similimum. Now, what do you mean by complete symptoms? Dr. Bonnie Hussain give a very key things for that. If we make the symptoms complete, they automatically become uncommon symptoms. How? Because of we add the location, sensation, we take the modality and concomitant to particular symptoms or the chief complaint. Automatically, we have convert this common symptoms to uncommon symptoms. Got it? For example, a burning pain, a burning like a call. Patient is say having a burning, but burning like a call. There's a severity is more. Along with that, the burning is relieved by application of heat. So now burning is a common symptoms of inflammation. Yes, if there is an inflammation, the burning is there. But this burning is relieved by warmth. So now this become a characteristic symptoms. So if we make the symptoms or we separate the symptoms in his sensation, location, sensation, modality and concomitant, automatically that symptoms will become a common symptoms. So for that, Dr. Boning said that totality of symptom not only a sum total of the symptom, but itself one a grand symptom, the symptoms of the patient. And for making the symptom as a grand symptom, the total itself 4 factor must be present. A symptom which clearly defined by the element of location, sensation, modality, and concomitant is called the complete symptoms. Now, location that means not the part we are seeing. In the location, there is a location, there is a direction of the pain, the change of location, right to left, left to right, up, above to downward, downward to above, the diagonally. So this everything is come under location. Sensation, that means any pain sensation or any patient's feelings, they come under sensation along with the complaint. So if the patient having a vomiting and vomiting is look like a groundwater vomiting or the vomiting is having an offensive smell. So this also come under sensation and complaint. And modality, the aggravation and amelioration, the condition where the patient symptoms is aggravated and ameliorated, and this modality if be present in the case or in the symptoms, they make the symptoms characteristic. And the concomitant, as I say, it is the most important symptom if they are present in the case. So it is a point to exert situation localization of the complaint. Sensation, any altered perception of the mind regarding the disease, it is either in a form of pain, any discomfort, both physically as well as mentally. Anything which modified for the better or worse in called the modality. It can be a term of time, place, climate, any circumstances that are related to food, drink also. For example, we are saying in arsenic, the burning is really by taking a warm food. In a phosphorus, the burning in stomach is really by taking a cold things. So these are the modality equal to food and drink. By place, close place, aggravate the complaint, open air, relieve the complaint, pulsarize the medicine. A time for 12 a.m., 12 p.m. aggravation in a case of arsenic. Sunrise aggravation, natrum and calcarea force, sulfur. Evening aggravation in case of pulsatilla and lycopodium. For example, damp weather aggravation in case of the dulcamara and arsenic. Cold weather aggravation in the hepatitis. So these are the symptoms. We are saying the modality, and modality are most important for us because of they define the characteristic symptoms and they help for the selection. The symptom measured with the chief complaint is called the concomitant symptoms. So now this complete symptoms, if we take the proper complete symptoms in the case, we are able to find out the characteristic symptoms. So try to make the symptoms complete. And so for that, Dr. Honeyman mentioned about the complete symptoms in aphorism number 86 in the case taking. We has to ask the patient and we try to make the symptoms complete. Clear? Now the clinical symptoms. What you mean by clinical symptoms? They are also because of Clark, Boric, they make the repertory on a clinical symptom. So now we have to know about the clinical symptom. They are help in a certain they are help for the selection of the symptom and they are casuistic one. So Boric has defined the clinical symptom as it does not appear the proving of the drug. It nevertheless has been invariably relieved by same drug given to another purpose. So here what Boric is saying, the clinical symptoms which are be not seen in a drug proving. But on a general state of the patient, we are, for example, in case of the gangrene, we not prove the medicine that the patients develop the gangrene. Yes or no? But the patient with the gangrene, they having a general symptoms related to arsenic. Now we prescribe arsenic to that gangrenous patient and that gangrene is relieved. So now the gangrene condition or there is a necrosis has become a clinical symptoms of that medicine. So the stitching pain in the chest are constantly relieved by brain which failed during the drug proving. In the brain there is a stitching pain. We are the keynote symptoms, but it's a clinical symptoms. There are the symptoms which could not be ascertained, including the drug pathogenesis by proving of the drug, but always relieve the same symptom when encountered in the patient. So these are the clinical symptoms which we are seen in a boric materia medica. It's all the symptoms mostly they are not only they are all full of clinical or pathological symptoms. Accessory symptoms of the medicine. So about the accessory symptoms of medicine, Dr. Hanuman mentioned in aphorism number 163, 180. The accessory symptoms of medicine. Especially when we are treating the disease, they're having a few symptoms. What we are saying, there is a one-sided disease. They're having a few symptoms. There is a one-sided disease. So in the one-sided disease, what happened that they're having a few symptoms and our prescription is totally based on symptomology. Here we not find out the symptoms. We are not able to see it because all the symptoms are obscure. So at the time we prescribe the partial similar remedy. And after prescription of partial similar remedy, our vital force is stimulated and they give a new set of the symptoms. And this new set of the symptoms are known as the essential symptoms of the medicine. These symptoms are not previously observed in the disease, but at the same time, symptoms of the disease itself and they are obscured by the tendency of that person. And then will be rarely perceived and they are perceived only after a prescription of partial similar remedy. And these accessory symptoms of medicine are helped to select the most minimum medicine in cases of one-sided disease. Now, lesser accessory symptoms. It is mentioned by Dr. Hahnemann in aphorism number 95. When we take the case of the chronic patient or chronic suffering, at the time, what happened with the patient? Patient are, due to a long suffering of a certain complaint, he become habitual. So, he assumed that this is my routine. For example, constipation. Constipation since 15 years. Patient having no any problem with that constipation because it is a used to with that constipation. So he was not revealing this. He is not revealing the symptoms in front of physician. But these long suffering symptoms are most important, more pregnant symptoms for the selection of the medicine. So in chronic disease, the patient get accustomed to their suffering and may not feel necessary to narrating these symptoms, which they have believed for long, which are the important for the choice of medicine. So they do not consider these symptoms having anything to do with the prescription. They do be made for presenting complaint. So he that much accustomed to that complaint, so he not narrating to the patient, physician. But if we find out these symptoms in the patient, they are becoming most constitutional symptoms of the patient. They help for the selection of the simillimum in a chronic cases. So after these things, why we know about the symptoms? Why? What is necessary to knowing about the symptoms? Our main aim to make the totality of the symptoms. There's a difference between a sum total of symptoms and totality of the symptoms. What do we sum total of symptoms? That means we make the total of every symptoms which are observed in the patient. But the totality of the symptoms, we have to follow three steps. The first, that is, we have to do the case taking properly. After that, we analyze the case. After that, we evaluate the case, and then we make the totality of the symptoms. So now, what do you mean by analysis and evaluation of the symptoms? Analysis. The name itself suggests lysis, to break down. to break down the symptoms in a different part. So from that we have to identify their symptoms. In short, we are to give a name to the each and every symptoms. For example, patient says to us, that I am having a thrombic type of headache in my frontal region is an aggravation by the sun and relieved by cold application or in a room, along with having a profuse urination. Now, this is a one symptoms. From that we differentiate, we analyze like a pain. Which type of pain patient have a pain like that? The location, there is a location. The location, there is a frontal headache. The frontal, so we has to differentiate medicine. The medicine is only indicated for the frontal headache. So this is a second, the sensation, throbbing sensation in the pain. The throbbing sensation is a characteristic of that medicine. Like for example, we apply the modality, aggravation by sunrise, that is aggravation by sun. So aggravation by heat of sun, it's become a characteristic symptoms. The last one, the concomitant profuse urination along with the headache, this become a concomitant symptoms. So one symptoms we classify or we analyze in a 4 part, and from that we has to identify the symptoms. Are you getting my point? So these are, from this analysis we have to that much differentiate which are the common to that disease or which are the uncommon to that disease. So the analysis of the symptoms or classification of the symptoms is the first step to reach the totality of the symptoms. So here we identify each and every symptom which is narrated by the patient. And for that, we have to do the 2 type. The first, that is, we have to differentiate in a location, in a modality, concomitant. Then we differentiate general to particular, common to uncommon, subjective to objective, and we analyze the symptoms. And from that, if we analyze, we give a proper identification to the symptoms. We know about the evaluation. Which symptoms is most important? If the patient having a mental state symptoms, they are most important. They put first place. The general symptoms, physical general symptoms, put the second stage. Uncommon particular, third stage. Common, they are no important. So when we are making a totality of the symptoms, we only take the symptoms they are first grade or second grade. The common symptoms we avoid. And so that's why the totality of the symptoms, analysis of the symptoms or the evaluation of the symptoms is totally based on knowledge of the symptoms. And for that we having a knowledge of symptoms. So a purposeful totality of symptom need a well-directed meaning of the case-taking procedures. And Dr. Honeyman says that the totality of symptoms in aphorism number 7 in the theoretical part, in 17 after case-taking we has to do this in our main aim to make the totality symptoms in 104 aphorism. The totality of the symptoms is totally based on the symptoms which we are taken from the case. So now Dr. Honeyman says that outward reflection of the picture of the internal essays of the disease, they are the principal symptoms or the sole guide the symptom. According to aphorism number 7. According to Stuart Rose, it means all the symptoms of the case we are capable of being logically combined in a harmonious and consistent whole having a quality and individuality. That means we harmony, we make the picture. We make the personality of the person, and this personality we match with the personality of multiple. According to H.A. Robert, the totality of the concrete form of the symptom, they were logically related to each other and stand for the individual recognizable form. If they are in a separate thing, we not individualize the person. But when we put it up one place, we have to individualize the person. So our key of prescription is a totality of the symptoms. And for reaching the totality of the symptom, to make the totality of symptom, we having a knowledge of symptoms. So there's a name of the topic. The key of prescription is a totality, it is symptomatology. So without knowing the symptom, we never reach the totality of symptoms. So what is the outcome? The accurate remedy selection. Symptoms help homeopathic selection, correct remedy leading to effective treatment. That is a holistic healing. What we are saying, we treat the person as a from mentally, physically, his spiritual health. We have to maintain everything. By given a most similar medicine, patient overall health leading to holistic healing, we minimize the side effect of the medicine. We see like the most similar medicine, they are affected on a most similar part of the vital force. So we will not see any adverse effect of that medicine. Improve patient's outcome. Our main vision or main goal is to restore sick to health to cure as it is termed. So for that, we have to knowledge of the symptoms, analysis, evaluation of symptoms, and totality of symptoms. So this is a certain reference from that and this PPT, and I take the reference from that. Thank you. Thank you very much.
Thank you, Dr. Komal Patel. Really amazing presentation. I must say, you really magnified the symptom into a beautiful picture. That's what I must say. What are the symptoms and how it can be defined, and what is the purpose of dividing symptoms into different categories, and how one can use it to say for the right selection of the remedy, and what are the things that what are the benefit you get out of choosing the right symptom, whether it be a common symptom, it's a general symptom, or a particular symptom. How can one differentiate all these symptoms? It's just like a one-day cricket. You just went up, and that's what I must say in the summary. If anybody, only just 4 minutes remaining, if anyone want to have a question or want to speak, you can come up and please raise your hand so that you can talk to Dr. Kamal Patel. Yes.
Sir, it is a very short time to describe the symptoms that I say. Symptoms is I say like a big whale. When we are jumping over that whale, we are not able to come out very easily. But this is some time limit and everything is there, so we have to cover only a more important things for the prescription, and that is my purpose to take it in with this platform.
Exactly. We used to say that the symptoms are the things on which one can prescribe the remedy. But when you get hundreds of symptoms, how will you differentiate the remedy? The people used to say, oh, we can do it, the repetition. If someone do the repetition with 100 symptoms, you will end up with 50 to 70 remedies. Then how will you choose the right remedy? Then that's why homeopathy, we used to say it is homeopathy is nothing but mathematics. You just take the symptoms in general and then add the symptoms on one side, and then you remove the symptoms of the patient, symptoms of common to the people, then you remove the symptoms common to the disease, and then you get some more symptoms, and then you can find the what is rare in the patient, and that is what symptom that will lead to the right remedy, and that will definitely work as a remedy, not simply a medicine, but it works as a remedy. Thereby, the patient disease will be cured 100%. That's what we can say. And that kind of presentation it was. Anyway, congratulations. I hope we can have some more presentation in the future. I am inviting Dr. Bob Lim to say auto thanks to the session. Dr. Bob Lim. There's a question. Do acute cases also need constitutional remedies?
In an acute case, first in this is not told by me. This is told by master of our master Dr. Honeyman. When the acute remedy or we prescribe the acute complaint, we first go to the symptom similarity. If this complaint, for example, like except in case of acute mental disease or acute skin eruptions, they require, because of Dr. Honeyman says that this origin is chronic, and so it required the after treatment of constitutional remedy. But each and every acute disease, what we are saying, when the patients occurring in a once in a lifetime or they are not recurring, they require no constitutional remedy. Only acute medicine is enough for treat that person. But in case of acute mental disease, a patient having a sudden shock, or that is due to some emotional cause, a fright or fear, and they having a maniatic condition or they become aggressive. So at the time, we not leave the patient only given a similimum medicine. Dr. Honeyman already says that we first prescribe the similimum medicine or the group of medicine like belladonna, stramonium, which having a efficacy on acute episode. But afterward that we has to prescribe antisoric medicine, because of here the miasm sora is become a very prominent. If we not prescribe at the time constitutional or miasmatic medicine, because of the constitutional remedies indirectly act as a miasmatic medicine, and if we not prescribe in this type of the cases, the recurrence is more.
Okay.
So it is a what I am give advice to the everyone, that is in acute disease, it is a once in a lifetime, there is a once in a first time. We not bothered about the constitutional remedy. But when they having a recurrence, and we think about the SORA is in a like a Dr. Hyman right in definition, it is a sudden explosion of the latent SORA. Now, without SORA, that not without miasm, that not possible acute disease also.
Okay, madam. Okay,
Uh,
next time we can
so
have
this
another session. I hope Dr. Bob Lim from Malaysia, you can say what of science, sir.
Uh, okay, I been following quite late about Dr. Patel's sharing tonight on this successful webinar of the International Forum for Promoting Homeopathy. I am Bob Lim from Malaysia. I'd like to congratulate Dr. Patel. Her full name is Dr. Komal Patel, for successful conducting a very informative and refreshing webinar, and you have covered all the topics very well, from the acute to the chronic and to how to repertorize with a patient when take case taking, and that is a very good informative session tonight. So on behalf of IFPH, I would like to say thank you and congratulate you for a successful webinar tonight. Thank you very much.
Thank you very much, sir. Thank you.
Thank you, Dr.
Okay, sir. Thank you very much, sir.
Thank you, Dr. Bob Lim. Thank you, Dr. Komal Patel, and those who attend the session in this evening. We are very happy to say that tomorrow we will have another session from Dr. Asha B. Varghese, and she will be talking about management of personality disorders with homeopathy. With that, we come to the end of the day 1673. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.